A lot of women think once the bleeding stops after a miscarriage or medical abortion, everything is automatically fine, but that is not always true. Some complications can remain hidden inside the uterus for days, weeks, or even longer if proper follow-up is not done. And this is one of the major reasons why a pelvic scan can be very important afterwards. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound. And in today's video, we will talk about the importance of a pelvic scan after a miscarriage or medical abortion. After a miscarriage or medical abortion, the body is expected to remove all the pregnancy-related tissue from the uterus. Sometimes this happens completely without any complication, but in some cases, some tissue still remain inside the uterus. This is called retained products of conception. And when retained tissues stay inside for too long, it can lead to several complications. How can a pelvic scan help? A pelvic ultrasound scan helps evaluate what is happening internally after the miscarriage or abortion. The scan helps to assess if the uterus has cleared completely and if it is empty. It also helps to assess if the uterus has returned to its normal size. It also checks if retained products are still present, if there are blood clots within the cavity, if the endometrium is still abnormally thickened, if there are any signs suggesting infection or inflammation, and if there are any other complications affecting the pelvis. One dangerous thing about retained products of conception is that sometimes symptoms are not always dramatic and immediate. Some women may still have light bleeding and think that recovery is progressing normally. Others may only notice occasional pelvic pain and ignore it. Meanwhile, retained tissue can cause irritation and inflammation inside the uterus. So what happens if complications are not detected early? One common issue is prolonged bleeding. Some women continue bleeding lightly or even heavily for weeks because retained tissues are still present inside the uterus. Another possible complication is infection. When retained products remain for too long, bacteria can grow within the uterine cavity, leading to pelvic infection. This may cause fever, lower abdominal pain, foul-smelling discharge, weakness, or even severe pelvic tenderness. If severe infection is ignored, it can spread beyond the uterus and become serious, which can lead to adhesions and future infertility. This is another important part that many people do not talk about. Persistent inflammation or infection inside the uterus may sometimes contribute to formation of intrauterine adhesions. These adhesions are bands of scar tissue that develop inside the uterine cavity. These scar tissues may partially make the walls of the uterus stick together. The uterus is usually hollow. That is why implantation and a baby can stay inside. But this scar tissue will make the uterus to stick together. In some women, severe adhesions can later affect menstrual flow, implantation, cause infertility, and affect future pregnancies. This is why early detection and proper management of complications matters. Please note, not every woman with retained product will develop infertility or adhesions, but untreated infections and prolonged inflammation can increase the risk of long-term complications. This is why your symptoms should never be ignored, even if they seem mild. Reduced bleeding does not always mean the uterus is completely empty. Feeling better temporarily does not mean complications are absent internally. A pelvic scan helps provide clearer information about what is happening inside the uterus instead of relying on only your symptoms or even ignoring your body because there are no symptoms yet. A pelvic scan is especially important if you are experiencing persistent bleeding, severe or ongoing pelvic pain, fever, foul-smelling discharge, passing repeated blood clots, weakness or dizziness, or symptoms that does not feel normal after a miscarriage or medical abortion. And even if there are no symptoms, please get a scan done after any miscarriage or medical abortion. A pelvic ultrasound scan after a miscarriage or medical abortion is all about assessing recovery properly, detecting complications early, and helping to protect your future reproductive health. Early evaluation can prevent more serious complications later, and a pelvic ultrasound scan may provide important answers about what is happening internally. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and follow for more ultrasound and women's health education that has been simplified for you. And I'll see you in my next video.